Welcome! This module will cover information on nutritional issues in the older adult. After viewing the module, you will be able to describe the significance of malnutrition in the older adult, recognize how aging changes impact nutritional status, and discuss how nutrition screening impacts malnutrition. Malnutrition is a condition that exists when the body does not absorb, utilize, metabolize, or manufacture enough nutrients from the foods or fluids that are consumed. It may also be defined as a condition of excess nutrients. In order to diagnose a patient with malnutrition, the Academy of Nutrition and Dietetics and the American Society for Parenteral and Enteral Nutrition suggest at least two of the following criteria be present. Insufficient energy intake, weight loss of a significant amount, loss of muscle mass, loss of subcutaneous fat mass, localized or generalized fluid accumulation that may mask weight loss, and diminished functional status as measured by hand grip strength. Up to 71% of older adults are either at risk or are malnourished. The risk for malnutrition increases with age. Early detection of malnutrition is important due to the impact it has on older adults in managing their daily activities. The direct impact of malnutrition on the body may cause symptoms such as tiredness, fatigue, muscle weakness, loss of strength, depression, poor memory, weak immune system, and anemia. Subsequently, malnutrition has been associated with diminished cognitive function, diminished mobility, and a diminished ability to care for oneself. Why are older adults at high risk for malnutrition? Malnutrition in the older adult is a multifactorial issue. Aging processes, inadequate intake, inadequate absorption, medication interactions, disease process, and inactivity all contribute to the etiology of this condition. The aging process is accompanied by physiologic changes that can negatively impact nutritional status. Changes such as diminished sense of smell and taste may result in a decreased appetite. Poor oral and dental health can cause inflammation and problems with chewing and swallowing, leading to inadequate intake. Inadequate intake can be caused by oral and dental health issues, but can also be caused by other factors, such as an inability to shop for food due to limited mobility from osteoarthritis and loss of vision or hearing. Along with these physiologic factors, older adults may also experience psychosocial and environmental changes such as isolation, loneliness, depression, and inadequate finances that impact their dietary intake. Aging is also associated with a decrease in physical activity and a depletion of lean body mass. Although energy needs decrease with age, the need for most nutrients remains the same, increasing the risk for malnutrition. It becomes a cycle. Decreased physical activity leads to a loss of muscle mass or sarcopenia, which causes a decrease in functional ability, further decreasing physical activity. This cycle places older adults at an even greater risk for malnutrition. As healthcare providers, how can we differentiate between malnutrition and normal aging changes in our patients and clients? You will assess for malnutrition risks, and to start that process, you will need a validated, objective tool. There are many screening tools available that have been both validated and proven reliable, but the tool that is most widely accepted for use in the over 65-year-old population is the Mini Nutritional Assessment. The Mini Nutritional Assessment, or MNA, seen here, was created by the Nestle Nutritional Institute. The MNA consists of 6 questions and can be administered in less than 5 minutes in a variety of settings. The tool requires no specialized training. Question A. Has food intake declined over the past 3 months due to loss of appetite, digestive problems, chewing, or swallowing difficulties? Question B. Weight loss during the last 3 months. Question C. Mobility. Question D, has suffered psychological stress or acute disease in the past 3 months. Question E, neuropsychological problems. Question F1, body mass index or BMI. Question F2 is used to replace question F1 if you are unable to weigh the patient or measure the patient's height. Calf circumference in centimeters. The patient is given a screening score based on responses to the 6 questions. From the score total, an assessment of their nutritional status is determined. For screening of nutritional status to be successful, the tool needs to be embedded in the routine care process of the clinic or facility. The tool should be incorporated in the electronic health record system so necessary referrals can be an automated process. All employees of facilities need to be trained in the administration of the M&A, and the process needs to be re-administered as needed. You may also use the tool to determine if the individual has improved after interventions have been put into place.